Thanks to the Commission and to the Robert Wood Johnson Foundation for this opportunity. I'm really honored to appear here today to talk about the relationship between health and community development in the context of Detroit, where the Kresge Foundation has been actively involved for many years. All of the comments of my colleagues on the panel today have really resonated, and all of the challenges that they've discussed land in Detroit, one of the most challenged communities in our nation. But Kresge, as part of its commitment to expanding opportunities in America's cities, has drilled down very intentionally in our home, the Detroit area, where our foundation was established in 1924 by Sebastian Kresge. We approach our work in Detroit through an integrated 9-part framework that is aiming at restoring the health and vitality of our home city through practical, community-rooted action. And those 9 aspects of community life encompass health, environment, the economy, arts and culture, education, and they land in both Detroit's neighborhoods and in its core city. Overall, our goal is to not work in silos, to break out of single discipline approaches to problems that really are very multifaceted and complex. We've had the program in place now for 4 years, and we're learning a lot from it. Detroit, as you know, evokes strong emotions for many people. It's often cited as our nation's best emblem of economic and population decline, racial disparities, high rates of violence, poverty, and unemployment, and poor health outcomes for residents of all ages. These conditions have forced us to look at the future of the city in very different ways. We now think really hard about what will it take to create the kind of community fabric that will serve our people in all dimensions, economic, physical, and social. How can we really encourage a sense of urgency about Detroit's challenges? And how can we think about reducing concentrated poverty and all of the stresses that it creates in this iconic place? Last, I think we need to think about how to restore market strength. There aren't enough resources in philanthropy or in government to bring back a city with 139 square miles of largely challenged neighborhoods. We have about 40 square miles of abandoned buildings and vacant property. That alone is a costly undertaking to try to sort out, and it's going to require a sequencing of actions and investments that has to be done collectively. What I really would like to talk about today is a few of those collective action interventions, I suppose is the word, to try to set Detroit on a different, more positive path for the future. Our fiscal crisis is reported every day in the Wall Street Journal and the New York Times. We're working really hard to address that, but even in the context of a looming municipal bankruptcy, the rest of the community is very focused on creating a new paradigm for the future. We've been working together on developing effective mass transit, which has eluded Detroit for my lifetime. As the home of the auto industry, we really had to kind of reject the idea that transit was important to people, and now even the auto companies themselves are proponents for a better transit system. We're working hard to create a stronger core city as the economic driver for the region that really centralizes economic activity, jobs, and residents in a place that is accessible to all. We're working hard to create a more innovative and student-centered system of schools, from preschool through P20 is the way we refer to it, but focusing a lot on small high schools and different ways of teaching and learning. We've done a lot at Kresge in particular to focus on arts and creativity as drivers for connecting people to place. I think the key difference in today's Detroit is that we all understand now that no single group can accomplish the difficult task of bringing back our city. Everyone, individuals, government, businesses, nonprofits, and foundations must be part of the process to restore our city to a position of health and prosperity. In my paper, I highlighted 3 fairly large endeavors to take this kind of collective approach to long-standing 20-year challenges that we've had. I talked a little bit about a mass transit initiative to build a streetcar line that ultimately is intended to feed into a regional effort to develop an intermodal, highly effective system of connecting people to jobs and other opportunities. I talked about a regional planning effort that focuses on the city itself. I've brought the executive summary today, the Detroit Future City work that thinks differently about land use, economic development, and systems within our city. And then I also talked about an initiative to maximize the impact of our 110-year-old Eastern market, which is the largest market in the United States and combines wholesale, food production, farm-grown produce, many different aspects of a really burgeoning local food industry in Detroit. The head of our health team, David Fukuzawa, calls it the epicenter of the local food movement in the United States. And we're very proud to see that happening in our older industrial city. Foundations have the ability to do things differently. And I'm here today looking at this work through a foundation lens. We have the ability to view issues whole. We can use multiple problem-solving methods. We can convene others, perform and support research. We can use the political capital that has accrued to us over 90 years as a respected institution. We can connect local stakeholders to national thinking that sometimes eludes the more challenged communities in America. We can maintain deep relationships with residents and leaders and activists in our community. And we can help be a bridge between the public sector and the private sector when needed. We have the ability and the mandate to take measured risk. And we need to also make sure that we ground our efforts in serving lower-income people and disinvested communities. In Detroit, foundations and nonprofits are part of the legacy left by the auto industry and the strong economic engine that existed there in the first half of the last century. Now we need to maximize that legacy. And we've done that by connecting with national initiatives such as Living Cities and the Green and Healthy Homes Initiative. We've looked at work in a more holistic way. I first heard the word holism or holistic in connection with health, and now in our work it's come full circle, so that we think of holistic solutions to the challenges of our community. The recommendations of the Detroit Future City framework are important to the health of residents. They propose ways to increase the number of jobs in the city, develop new neighborhood forms that serve longtime residents, not by displacing them, but by allowing them to remain in their homes if they so choose, in a safer environment. We can use our vacant land as assets, and I think that's a new idea in Detroit. How can the land really attain its true value through productive reuse? How can we provide more active living opportunities where residents feel safe, and we can provide green, healthy neighborhoods that have dense, active, walkable communities with good recreation, open space, fresh food, retail, and commercial services, and link all of that to early childhood education and K-12 education. So we've begun to imagine a different kind of community. All of the imaginations of Detroiters are coming together to think about a new way. Economic security will lead us to better health, mental and physical, for parents and children. Stable housing will provide the prerequisite for wellness. And social connectedness will come from better quality of life and result in more attachment to community, involvement, and residents' own agency about the decisions that need to be made. There are a number of lessons learned that I identified in the paper today, but I also wanted to just highlight 3 important areas. We have to recognize that this work is long-term, but not be satisfied with waiting for long-time solutions. We have to be demanding that the urgency is now. We need to make sure that the approaches originate within communities, otherwise they won't gain traction, and we need to not give up. We need to think about innovation having many forms, and succeeding in the most difficult places that we serve is a clear form of innovation that's much needed in America. Detroiters are more hopeful now than they've been in the 25 years that I've been in the community development field, despite the fiscal challenges that we have. I think we feel the burning platform very acutely, but we also see through experience and collaboration and respect for each other a new way forward for the city. Thank you.